to Chizuba Talks, the podcast celebrating nonprofits and their impactful work in communities, inspiring change and fostering growth. Today's guest is Dr. Jessica Shore of the Nava Center. Dr. Jessica is a licensed clinical psychologist and founder of the Nava Center. She specializes in trauma with over 10 years of experience. She is credentialed through PsyPact for telehealth and is a certified professional in diversity, equity, inclusion, and organizational change. Welcome to Chizuba Talks, Dr. Jessica.
Hi, thank you for having me.
Uh, is it okay if I call you Jessica?
Yeah, absolutely.
Yeah, Jessica, thank you. Jessica, tell us, how did you come about founding this nonprofit, the Nava Center, and how do you help in empowering and helping people out?
Yeah, great question. I have been working in the field of psychology, doing trauma work for a long time, and I saw a real need for high quality trauma services for anyone who maybe doesn't have insurance or only has Medicaid state funded insurance. And what was happening is there were a lot of people who needed trauma services, but their insurance didn't cover the providers that were providing it, and they didn't have enough money to pay for the services out of pocket. So, part of what I wanted to do with the Nava Center is create a space where people can come, and we use a sliding scale starting at zero, depending on annual household income, so that people can receive high quality trauma care regardless of their income. The other reason that I started the Nava Center is because I'm really passionate about equity and anti racism. And the agencies that I was working in were not allowing of some of the programming that I wish would be allowed to happen. So I wanted to create a space where we could have that programming, where we would be an anti racism organization from the inside out, not just doing stuff in the community, but also internally for the staff so that everybody's coming from the same place. So we provide both, individual and group trauma therapy, and we also provide engagement in anti-racism through workshops.
What are the common approaches that you use at the Nava Center? When somebody comes to you, and a new client comes to you, uh, what does a typical day look like?
Yeah, so when someone comes to us, we are always coming from a trauma informed anti racist lens, meaning that we're taking in what happened to someone and their entire system and not looking at them as if there's something wrong with them or as if this isn't a problem that can be solved. So when we meet with clients, we talk with them about what are their goals, what are their hopes, how would they know that they felt better? And then we talk to them about different approaches and how to get there. So we use some evidence-based practices like cognitive processing therapy, prolonged exposure, eye movement desensitization reprocessing, trauma-focused cognitive behavioral therapy, and we also use dialectical behavior therapy. So we use a lot of different approaches and we work with our clients to see what is going to be best for them and how we
Mhm.
can help them and what interventions will be used with them to get them to meeting their treatment goals.
Interesting. So, how long does a typical client need to be there? You start with one session, maybe 10 sessions. Obviously, it depends on the kind of therapy that they are getting. But on an average, how many sessions does your organization provide?
Like you said, depending on the intervention, depends on how long. Some of them are shorter term, some of them are longer term. I would say folks stay with us about a year, 2 years. And at that point, we've completed at least a piece of work. And sometimes they want to take a break. And sometimes, they feel like they've reached their goals and they can move on. We do have people that come in and, they're in and out in 3 or 4 months because of the specific intervention. And some people we've had since day one when we started in August 2021, and they're still with us. So it really depends, but I think an average would be like a year and a half.
Year and a half. Right. Right. So, when you say ongoing training, ongoing therapy sessions, uh, the professional development also needs to be done, right, for therapists at the Nava Center? Because if it is such a long term process, then there has to be some kind of upgrading of the trainings.
Yeah, absolutely. We can't forget about training our therapists. And so we offer in house anti racism training and engagement for all of our therapists. And that's free to them. And then they come and they can get CEUs for that. We have groups for our white therapists, we have groups for our therapists of color. And then after they've been with us for a little while, we also help finance additional continuing education credit. So most recently, the three of us that have been there the longest, we took EMDR training together. And, and that it's an ongoing process. So, every year we do training to even keep up the different certifications that we have. And we also
Right.
have ongoing supervision too. So we have every other week we have supervision to provide support for each other because that's also really important for the therapist. You're hearing all this really hard stuff and you need a place to process it yourself.
Absolutely, I understand. I have a friend who's actually currently pursuing a psychotherapist role, a course, and he says it is so challenging for me to be sane when I'm listening to so many cases. And how do you manage to do that?
Well, yeah, self-care is tough because it's so important and I think a lot of us don't make enough time for it. So at the Nava Center, I am really, really clear with all of my clinicians that taking care of themselves is the most important thing. They cannot
Absolutely.
provide good care for their clients if they're not taking care of themselves. And I believe that for myself and I believe that for everybody in the field. So, we really promote, we go out once or twice a year together to have brunch, and, just to have a non-clinical engagement. I personally, I do a lot of reading, I do a lot of walking, spending time with friends. I always try to figure out with my staff, what makes you happy, what brings you joy, so that I can remind them to do those things throughout the day, the week, the year. Because I think sometimes we need reminders in self care.
Yes. Yeah. Do you have any collaborations with some organization or institution where you are able to, you know, some sort of mutual understanding and help support?
So we recently partnered with the Women's Wellness Space in Philadelphia, and we provide therapy to the women that attend there. These are women that are impacted by incarceration. Either they themselves have been incarcerated, or incarceration has impacted them in some way in their family life. So we have partnered with them, and we do that once a week, and we're planning to expand that, and offer groups and more individual services. We don't have other partnerships per se, but we have a lot of clinicians in the community that send us their clients because they really believe in the work that we do. And they want to make sure that clients are getting really high quality care, but also being able to process their trauma. So I wouldn't call it a partnership, but we never lack for clients. We always have people funneling in, and I'm always trying to figure out, the best way to meet everybody's needs.
Right. Do you feel, Jessica, over the years, how long have you been operational?
We first provided services in August 2021. So we are having our
20.
third birthday party this month.
Okay, well, happy birthday.
Thank you.
So, my question was in these 3 years, have you seen the number of people coming in for therapy increasing? And what are the typical cases about?
Yes, cases come in all the time. I just sent out we have a yearly email that goes out with updates and requests for feedback. And we are seeing over 100 clients now, whereas last year we were seeing, I believe, 60. So we've definitely increased the amount of clients. And clients come to us with all different kinds of trauma. A lot of it is early childhood trauma. Sometimes we'll get folks that have had like a one off, a car accident or a work accident that has led them to us. But most of the time, we have folks that are presenting with complex PTSD, which means that they've experienced trauma for a long time over the course of years, and it's lots of different kinds of trauma as well. And that's unfortunately our pretty typical case. We also see a lot of folks with chronic illness who, have a history of trauma and they've developed these somatic symptoms as well. So those are pretty typical cases too.
Right. For people listening to this podcast, Jessica, what advice would you have for somebody who is thinking about approaching an organization like yours to help themselves? What would your advice be? Because, going to therapy, I mean, I know the stigma is not as much as it was earlier, but what would you say is the threshold of where a person should approach an organization like yours for therapy?
I think if your trauma, or really, even if it's not trauma, even if it's anxiety or depression, if your symptoms are getting in the way of your life, you need to reach out. And the hardest thing is to reach out. But once you do that, once you get the ball rolling, it becomes much easier. And so I would say if you are not living your life the way that you want to live it because of things that have happened to you, that's when you
Hmm.
should reach out because life can always be worth living. We just have to figure
True.
out how to convince you of that.
That's beautiful advice. Absolutely wonderful. Well, last question here, Jessica. What opportunities do you have for volunteers and how can somebody support you?
Yeah, so volunteers, we love volunteers. We have lots of different things for volunteers to do. We have an active social media, and we always need volunteers to help with that. We have volunteers that help with um, spreadsheets and finances. We always need help with that because those volunteers are doing things that I certainly am not very good at doing. And also, if we have volunteers who help take pictures at our events or come to our events to lead different like we have someone who comes to do yoga. So if you are someone who has a talent and you want to, maybe use your talent with us, like you want to host something. We had someone host a yoga event. We had someone host a sound bath where people could come and they were able to, donate some money to participate in this, and then that money went to us. So that was really great. Um, the best way to support us is by getting our name out there, participating in our anti-racism programming that is open to anyone, that's open to any individual. We have something for everyone. And of course, financially, if you feel like you want to help trauma survivors get therapy for free, if you want us to be able to do our equity work in the community, obviously money always helps, but there's lots of different ways to support us.
Wonderful. Thank you, Jessica, for talking to us. And you are doing amazing work. I'd like you to share your website and social handles here for people who are listening to this.
Great. So we are at www.thenavacenter.org. We are on Facebook and Instagram at the Nava Center, and we are also on LinkedIn at the Nava Center.
Perfect. Well, thank you so much for talking to us. And your dedication and your leadership at the Nava Center is amazing and truly inspiring.
Thank you. Thanks for having me.